In this video, we are talking about 12 uncommon but serious warning signs of low oxygen levels in the body, especially in older adults. Many seniors live every day with tiredness, dizziness, shortness of breath, or confusion, thinking these problems are just part of aging. But the truth is, these signs can sometimes mean that your body is not getting enough oxygen. Oxygen is what keeps your heart beating properly, your brain thinking clearly, and your muscles moving with strength. When oxygen levels drop, the whole body slowly starts to struggle. Today, I will gently walk you through 12 important warning signs that many people do not realize are connected to low oxygen. I will explain what each sign means in simple words, why it happens, and when it is time to take it seriously. Before we start, I'd love to know, where are you watching from today? Just drop your state or city in the comments below. It helps us feel like one community here, learning together and supporting one another. And if you have any natural health tips of your own, feel free to share those too. Someone else might really benefit from hearing what's worked for you. 1. Rapid heartbeat. Sometimes, you may be sitting quietly, watching TV, or resting in your chair, and suddenly your heart starts beating very fast. It may feel like it is racing, pounding, or fluttering in your chest. Many older adults feel this and think, maybe I got anxious, or it will pass. But this fast heartbeat can be one of the first warning signs that your body is low on oxygen. When oxygen levels drop, your heart tries to protect you. It beats faster so it can push more blood, and more oxygen, toward your brain and vital organs. This may sound helpful, but over time it puts extra strain on your heart. You may feel chest tightness, shortness of breath, dizziness, or even sudden weakness along with the fast heartbeat. This is very common in seniors who have lung problems like COPD, heart conditions, or even during infections. Sometimes it can happen suddenly with blood clots in the lungs or serious breathing trouble. If the heart works too hard for too long without enough oxygen, it can lead to irregular heart rhythms or even heart failure. Please hear this clearly, a fast heartbeat that happens often, especially with fatigue, lightheadedness, or breathing trouble, should never be ignored. It is your body asking for help. Treatment usually focuses on fixing the oxygen problem, through oxygen therapy, breathing treatment, or heart care. 2. Excessive sweating, cold, clammy skin without a clear reason. Have you ever suddenly started sweating even though the room was not hot and you were not moving much? Your clothes feel damp, your skin feels sticky or cold, and you feel uneasy inside. Many older adults think this kind of sweating happens because of age, anxiety, or weakness. But sometimes, this type of sudden sweating is a warning sign of low oxygen in the body. When your body does not get enough oxygen, it goes into a stress state. It releases stress hormones that can trigger cold, clammy sweating. This is not the same as sweating from heat or exercise. This sweating often comes with fast breathing, a racing heart, weakness, or restlessness. You may feel uncomfortable and unable to relax. This can happen in people with asthma, COPD, heart disease, or during serious infections. It can also appear with carbon monoxide exposure or at high altitudes. In more serious situations, this sweating can be a sign that the body is starting to struggle to protect vital organs like the heart and brain. If sweating is joined with shortness of breath, chest pressure, dizziness, pale or bluish skin, it becomes a medical emergency. This is not something to wait out at home. 3. Bluish color on lips, fingertips, or skin. Sometimes the body shows low oxygen in a way you can actually see. If you ever notice your lips, fingertips, or nail beds turning bluish, grayish, or unusually pale, this can be a serious warning sign called cyanosis. Many seniors mistake this change for cold weather, circulation problems, or poor lighting. But this color change often means that your blood is not carrying enough oxygen. Oxygen-rich blood is bright red. When oxygen levels drop, the blood becomes darker, and this causes the skin to take on a bluish or gray tint. This is usually easiest to see on the lips and fingers. For people with darker skin tones, it may show inside the mouth, gums, or eyelids instead. This can happen suddenly during severe breathing trouble, asthma attacks, choking, lung infections, or blood clots in the lungs. It can also develop slowly in long-term lung or heart disease like COPD or heart failure. In any case, this sign should never be ignored. If cyanosis appears suddenly, it can be life-threatening. It may mean your lungs are not delivering oxygen properly, or your heart is unable to pump oxygenated blood effectively. Without fast treatment, important organs like the brain and heart can be damaged. Please remember this clearly: blue lips or fingertips are an emergency sign. This is not a wait-and-see situation. Immediate medical care and oxygen support are needed to protect your life. 4. Confusion, forgetfulness, or sudden mental changes. Have you ever felt mentally foggy, confused, or unable to think clearly for no clear reason? Maybe you walk into a room and forget why you went there. Maybe you struggle to find simple words, feel lost in familiar places, or feel unusually confused during conversations. Many older adults quietly worry that this is just part of aging. But sometimes, these mental changes are not from aging at all, they are from low oxygen reaching the brain. Your brain needs more oxygen than almost any other organ. When oxygen levels drop, the brain is often one of the first places to suffer. At first, the changes may be small: trouble concentrating, short-term memory problems, slow thinking, or feeling mentally tired. But if oxygen stays low, confusion can become more serious. A person may seem disoriented. 5. A strange feeling of happiness or floating, euphoria. This one may surprise you. Sometimes, when oxygen levels drop in the body, a person may not feel scared or weak at first. Instead, they may feel unusually happy, calm, light, or disconnected from reality. You might feel like you are floating, dreamy, or strangely carefree. This feeling is called euphoria, and it can be a hidden warning sign of low oxygen. When the brain does not get enough oxygen, it releases stress chemicals like adrenaline. These chemicals can create a temporary feeling of excitement or emotional calm. At first, it might even feel pleasant. But this is dangerous because it can hide how serious the oxygen loss really is. A person may ignore shortness of breath, racing heart, or weakness because they feel okay emotionally. This type of euphoria is often reported in altitude sickness, where climbers feel oddly joyful just before their condition becomes severe. It can also happen in cases of carbon monoxide exposure or serious breathing problems. Please understand this clearly: feeling strangely happy while your body is struggling for oxygen is not a good sign. It means the brain is already under stress. If oxygen is not restored quickly, this can lead to fainting, collapse, or even seizures. 6. Blurred vision, tunnel vision, or seeing flashes of light. Your eyes need oxygen just as much as your heart and brain do. When oxygen levels drop, your vision can begin to change in strange and frightening ways. You may notice that your sight becomes blurry, like looking through fog. You may have trouble focusing on words while reading, or faces may not look clear. Some people begin seeing flashes of light, dark spots, or shadows that come and go. In more serious cases, a person may develop tunnel vision, where only the center of what you look at is clear and everything around it fades away. Sometimes, vision may even go dark for a few seconds. These changes can be very scary, especially when they happen suddenly. This happens because the retina and optic nerve, which send visual messages to the brain, are very sensitive to oxygen loss. When oxygen supply drops, blood flow to the eyes becomes weaker, and the visual system struggles to work properly. Older adults with COPD, sleep apnea, heart disease, or those exposed to carbon monoxide are at higher risk. These visual problems can also appear at high altitudes, where the air contains less oxygen. Sometimes vision improves once oxygen levels return to normal. But if low oxygen continues for too long, the optic nerve can be permanently damaged, leading to lasting vision loss. 7. Feeling lightheaded, dizzy, or off balance. Have you ever stood up and suddenly felt the room spin, your head feel light, or your balance feel unsteady? Many seniors brush this off as low blood pressure or moving too quickly. But often, this dizziness is a sign that your brain is not getting enough oxygen. Your brain needs a steady flow of oxygen to control balance and awareness. When oxygen levels drop, the brain struggles to keep everything steady. This can cause lightheadedness, dizziness, or a feeling that you might faint. In more severe cases, a person may actually lose consciousness for a short time. This is especially common in people with anemia, lung disease, heart conditions, or problems with circulation. The inner ear, which helps control balance, is also affected by reduced oxygen. When oxygen is limited, blood is redirected to the brain and heart first, leaving less support for the balance system. This makes you feel unsteady. Chronic dizziness may mean long-term oxygen shortage, which can slowly weaken the body. Sudden severe dizziness, especially when paired with shortness of breath, chest discomfort, or confusion, can point to carbon monoxide exposure or serious breathing trouble. Please do not ignore dizziness. Falls are one of the biggest dangers for older adults, and oxygen-related dizziness greatly increases that risk. Keeping your oxygen levels healthy helps keep your balance, safety, and independence. 8. Constant fatigue, weakness, and unusual drowsiness. Many older adults feel tired every day and assume it is just part of aging. But there is a difference between normal tiredness and the deep, heavy exhaustion that comes from low oxygen in the body. When your cells don't get enough oxygen, they cannot produce the energy you need to move, think, and function properly. This leads to constant fatigue that does not improve with rest. You may notice that tasks you once handled easily, like walking, cooking, showering, or even talking for long periods, now feel overwhelming. Your muscles may feel weak, heavy, sore, or shaky. Even after sleeping, you wake up feeling drained instead of refreshed. Mentally, you may struggle to focus, stay alert, or keep your thoughts organized. This type of fatigue is common in seniors with COPD, sleep apnea, heart failure, and other breathing or heart conditions. It can also appear suddenly during respiratory infections or at high altitudes where oxygen is lower. As oxygen levels keep dropping, fatigue can turn into unusual drowsiness. You may feel like sleeping all the time, have trouble staying awake, or feel mentally slowed. This is dangerous because extreme drowsiness can lead to confusion, accidents, or loss of consciousness. Your energy is precious. If your tiredness feels heavy, constant, and unexplained, it may be your body quietly asking for more oxygen. Supporting your breathing and circulation can restore strength, alertness, and quality of life. 9. Nausea, upset stomach, or vomiting without a clear cause. Many people think nausea or vomiting only comes from food problems, infections, or medications. But what many seniors do not realize is that low oxygen levels can also upset the stomach. Your digestive system, just like your heart and brain, needs oxygen to work properly. When oxygen is low, the stomach and intestines become stressed, and this can lead to nausea, a sour feeling in the stomach, or even vomiting. Low oxygen can also affect a special area in the brain that controls nausea and vomiting. When this part of the brain does not get enough oxygen, it can trigger sickness even when the stomach itself is not ill. This is why some people suddenly feel nauseated during breathing trouble, severe fatigue, or carbon monoxide exposure. Vomiting is the body's emergency response, but repeated vomiting is dangerous, especially for older adults. It can lead to dehydration, which makes it even harder for the blood to carry oxygen throughout the body. This creates a harmful cycle where oxygen levels drop even further. If nausea or vomiting happens together with shortness of breath, dizziness, sweating, confusion, or extreme weakness, it should never be ignored. These symptoms together often mean the body is under serious oxygen stress and needs medical help. 10. tingling, numbness, or pins and needles, in the hands and feet. Have you ever felt that strange tingling, prickling, or numb feeling in your fingers or toes, as if they were asleep? Many seniors blame this on poor circulation, diabetes, or simply sitting too long. While those can be causes, low oxygen levels in the body can also create these exact sensations. Your nerves need oxygen to send clear messages between your brain and the rest of your body. When oxygen supply drops, those nerve signals become weak or interrupted. At first, you may feel like tingling. If oxygen remains low, this can turn into numbness, weakness, or a cold feeling in the hands and feet. The fingers and toes are especially sensitive because they are farthest from the heart and lungs, where oxygen enters the body. In people with heart disease, lung disease, or poor circulation, oxygen has an even harder time reaching these areas. This is also a common warning sign in carbon monoxide exposure, where oxygen delivery is blocked inside the blood itself. At high altitudes, where oxygen in the air is thinner, this tingling may appear suddenly. Some people shake it off as mild discomfort, but it often means that oxygen supply to the nerves is struggling. 11. Frequent or unusual headaches. Many older adults live with headaches and quietly accept them as part of stress, dehydration, or changes in sleep. But what many do not realize is that frequent or unusual headaches can be an early warning sign of low oxygen in the body. Your brain is one of the most oxygen-hungry organs you have, and when oxygen levels drop, the brain feels it quickly. When the brain does not get enough oxygen, the blood vessels inside the head widen in an effort to bring in more oxygen. This sudden change in blood flow creates pressure and pain, which you feel as a headache. Some headaches feel like a tight band around the head. Others may throb, pulse, or feel heavy behind the eyes. These headaches may appear with dizziness, blurred vision, nausea, confusion, or unusual tiredness. Many seniors treat them with pain medicine and move on with the day, not realizing the real cause has not been addressed. Over time, ignoring oxygen-related headaches can allow more serious symptoms to develop. Low oxygen headaches are common in people with COPD, sleep apnea, heart problems, and in those with breathing issues during sleep. They can also appear with carbon monoxide exposure or serious lung infections. 12. Rapid breathing, breathing faster than normal without a clear reason. Sometimes you may notice that your breathing feels faster than usual, even when you are not walking, exercising, or feeling anxious. Your chest may rise and fall quickly, your breaths may feel shallow, and you may feel like you just can't get a deep, satisfying breath. This is called rapid breathing, and it is one of the body's strongest warning signs that oxygen levels are too low. When the body senses that oxygen is dropping, it immediately tries to fix the problem by making you breathe faster. The goal is to pull more oxygen into the lungs. But fast, shallow breathing often does not work well. Instead of improving oxygen levels, it can lead to lightheadedness, tingling in the hands and feet, chest tightness, and increased anxiety. This is very common in seniors with asthma, COPD, lung scarring, heart failure, or serious infections like pneumonia. It can also happen suddenly at high altitudes or during carbon monoxide exposure. In children and older adults, unexplained rapid breathing can be an early sign of a serious medical emergency. Rapid breathing is exhausting. It strains the lungs, the heart, and the nervous system. If it continues for too long without proper oxygen support, it can lead to severe fatigue, confusion, and even collapse. Please remember this, breathing fast is not just a breathing issue, it is often an oxygen crisis. If rapid breathing appears with dizziness, chest pain, bluish lips, or confusion, immediate medical care is needed. Your breath is your life. Protecting it protects everything else. My dear friends, thank you for staying with me through this important conversation today. Low oxygen in the body is not something we talk about enough, yet it affects so many lives quietly. The signs you heard today, fast heartbeat, sweating, bluish lips, confusion, dizziness, fatigue, tingling, headaches, and breathing changes, are not just random problems. They are messages from your body. And your body deserves to be heard. If something you heard today felt familiar, please do not ignore it. Talk to your doctor. Share these signs with your family. You are never a burden for caring about your health, you are being wise. If this video helped you understand your body better, please give it a thumbs up. It helps our channel reach other seniors who may need this information just as much as you. Don't forget to subscribe and turn on notifications so you never miss a future video made just for your health, comfort, and peace of mind. Thank you for trusting me with your time today. Stay safe, stay strong, stay informed, and I will see you again in the next video.